updates meeting. Quick introduction, my name is Umar Najib. I'm an associate professor of neurology at the Rockefeller Neuroscience Institute at West Virginia University. And I'm going to talk today about the use of transcranial magnetic stimulation in neurology. Quick disclosures, I'm going to talk about on and off-label application of devices. I serve as a principal investigator on clinical trials sponsored by Teva, Lilly, Electrocore, and Theranica, and I'm also a consultant for Allergan and AbbVie. So transcranial magnetic stimulation, as the name suggests, it's transcranial, so across the skull, magnetic, and a stimulation. It's a way of non-invasive brain stimulation or non-invasive neuromodulation. And I'm going to talk about a few diagnostic applications and a few therapeutic applications of TMS. The focus would mainly be on the characterization of neurobiology using TMS, certain TMS paradigms as physiological biomarkers, and prediction of treatment response. On the therapeutic side of things, we'll briefly talk about stimulation either alone or in combination with other interventions that may be beneficial in neurological disorders. This is a roadmap of my talk today, and I'm going to talk about most of these things individually as we go along. As you can see in the diagnostic list of things, there are the main usages that we'll talk about today would be investigating central motor conduction, motor cortical output mapping, cortical reactivity, cortical plasticity, metaplasticity or functional connectivity, and then cortical excitatory and inhibitory balance or intracortical excitatory markers. On the therapeutic side of things, I'm not going to talk about medication refractory depression, which, as you would know, is one of the FDA-approved therapeutic uses of TMS, since our psychiatry or behavioral medicine colleagues typically use TMS in this regard. I'll focus more on migraine, stroke, and neurorehabilitation, and then a few words about Alzheimer's and some of the other things. If you remember from your old days in physics, the Maxwell-Faraday equation, which suggested that a time-varying magnetic field is always accompanied by a spatially varying, non-conservative electric field, and vice versa. And this was the basis of electromagnetic stimulation, and dates back as far as the late 1800s, when in the picture on the left, picture A, you can see Jacques Arsène showing that when one places the head into an electromagnetic coil, they experience phosphenes and vertigo. Later on, in the early 1900s, Sylvanus Thompson showed that magnetophosphenes can also be induced from the stimulation of occipital brain cortex. And on the right, you see Anthony Barker, who's regarded as one of the most influential figures in the current form of TMS, who in the 1970s came up with a device which was capable of generating peak fields of 2 Tesla with an approximate rise time of about 100 microseconds or so. Eventually, in the 1980s, mid-80s, the TMS as we know of today was developed.